Good afternoon, everyone, and welcome to this session of Nurse Digest. My name is Margaret Dempsey, working for APNA. Today I'm joined by Maxwell Vloeberghs from the Australian Digital Health Agency, and we're going to be looking at My Health Record, improving communication between specialists and general practice. I would like to start by acknowledging that APNA and the Australian Digital Health Agency acknowledge the traditional custodians of the lands across which we meet and pay my respect to their elders past, present and emerging. I'm coming to you today from Wadawurrung country in Victoria. So welcome, Max.
Thanks, Marg. This is our session today, and yeah, as Marg mentioned, it's about working with specialists and so specialists and nurses that work in specialist practices. Okay, so to start off, I'm going to start off with talking about the National Digital Health Strategies. So the Australian Digital Health Agency has been working on has worked on the National Digital Health Strategy in cooperation with the Council of Australian Governments. And this strategy has been tasked with improving health outcomes for Australians through the use of digital health, education, as well as supporting healthcare providers nationally to implement digital health tools in their practice. So in the strategy, as you can see on the screen here, we have 7 priority areas. So the first priority area is My Health Record. Then we have secure messaging. So that's the exchange of health information in a secure manner. We have data quality and interoperability. We have medicine safety. So also within medicine safety is electronic prescriptions. Then we have enhanced models of care, quality and safety, workforce and education. So that's delivery of digital health technology, and as well as driving innovation. But today we're going to be focusing on the first priority, which is the My Health Record. So My Health Record is not something new. It's been around for many years, and at the moment we have over 23 million My Health Records in Australia, and more than 22 million records actually have data within them. So 9 out of 10 Australians will have a My Health Record with data in them. And so most of you online today would have a My Health Record as well. So just to give you a bit of an overview of what My Health Record is, it's essentially a secure online summary of an individual's health information. My Health Record is personally controlled. So a person can choose how much they interact with their record. If they want to, they can upload documents, or if they have concerns around privacy, they can set access controls as well for their record. It's part of a national system. It's available around Australia any time of the day, so 24 hours a day, 7 days a week. And it's also protected not only by cybersecurity, so there's data encryption, firewalls, 24-hour system monitoring, but it's also protected under legislation. So My Health Record needs to be used for its correct use, which is when you are providing healthcare to a patient, you can then go ahead and access their My Health Record. So how are healthcare providers around Australia using it? So as you can see here, we have 99% of pharmacies that are connected to My Health Record and using My Health Record around Australia, and 99% of GPs as well. In the public hospital area, we have 95% of public hospitals that are connected. And in the specialist area, currently we have 22% that are registered. But this is a space that we're working a lot with at the moment. We're working with a lot of primary healthcare networks, trying to spread the word about My Health Record and how specialists can benefit from using My Health Record as well. And so as you can see here, within a My Health Record, currently there are 608 million documents that have been uploaded either by consumers and healthcare providers. And so how's that actually broken down? So 246 million of those documents are clinical documents, so uploaded by healthcare providers, hospitals, pathologists, radiologists. Then you also have medicine documents, which have been uploaded by healthcare providers, pharmacists, GPs, and then that's at 362 million. And then we have the consumer documents as well. So consumers are actually are starting to upload more and more documents to their My Health record. So what are some of the benefits of My Health record for specialists and other practices? So it's that quick and easy access to health information. So that information can be received directly. There's less administrative burden with gathering that information. So for example, specialist letters, you don't need to contact other specialists to track down that information. You'll be able to get it through accessing a patient's My Health record. There's also improvements in clinical decision making through access to patient-specific information. Through access to My Health record, you can avoid duplicating tests. So for example, if your patient has recently had a blood test done and their report is on My Health record, you don't need to send them for another blood test because you can actually access that report through My Health record. So that really helps with both patients and providers. And also access to information about end-of-life care decisions from the advanced care documents as well. So we often do get questions about who can actually access My Health record and upload to My Health record. So My Health record can be accessed by healthcare providers who have a legitimate reason to access the system. And so that is providing care to the patient. So they're authorized to do so when they are providing care to the patient. So they have the authority to view My Health record. For your information, it's really important to know that My Health record should not be accessed for insurance purposes or pre-employment assessment either. So it's to be used for providing healthcare to a patient. So when you're providing healthcare to your patient, you can access My Health record. You can also upload to My Health record when you're providing healthcare to that patient. However, it is, even though you can upload to My Health record without speaking to them first, it is best to let a patient know when you are uploading documents to their record, just so that they know what documents are in their record, and then they can share that information with other healthcare providers. Now, when it comes to sensitive health information, there are certain state and territory laws that require you to speak to a patient before uploading sensitive health information. However, in general, particularly when you are uploading sensitive information, you should be checking with the patient as well. That's best practice. Okay, so when it comes to the My Health record documents, they fall under three different categories. So you have the provider documents, the consumer documents, and the Medicare documents. So under the provider documents, we have documents uploaded by practices, so your shared health summaries, discharge summaries from hospitals, pathology reports, diagnostic imaging reports, dispense records from pharmacies. So these are your provider documents. Then you have your consumer documents, such as personal health summaries, personal health notes, advanced care planning documents, and childhood development documents. Now, when it comes to personal health notes, this can be particularly helpful if for example, your patient has quite a challenging mental health care story and they don't want to share it over and over again. They can actually upload it as a personal health note, and then any of their healthcare providers can read through it rather than having the patient having to repeat what they've been through, especially when that experience can be traumatic. Then you've also got Medicare documents. So that's your MBS and PBS claims, your organ donor register status, and the Australian Immunisation Register information as well. So your your AIR information pulls through to My Health Record. So in the middle, you'll see these overview documents. So these are system generated documents. So they take documents from from all the other documents that are uploaded into My Health Record, and they put it into like a relevant subject. So you have medicines information all pulling through into the medicines information view, Medicare overview, you have immunization view, pathology reports pulling into the pathology overview, and diagnostic imaging reports in the diagnostic imaging overview. So we often get questions around My Health Record, privacy and security. So I just want to really reiterate that there are many safeguards in place to keep the My Health Record system safe and the documents safe within the My Health Record. So that includes, as I mentioned, strong encryption, firewalls, secure login processes, and there's also audit logging as well. The agency has a cybersecurity team that monitors the system 24 hours a day. And as I mentioned, My Health Record is also protected under legislation, and there can be penalties for deliberate misuse of the system. All data is stored within Australia as well, so it's stored securely in Australia. And any software that's attempting to connect to My Health Record needs to go through a conformance process. So there are also some controls at the patient level, which is an integral feature of My Health Record. So I've spoken to individuals who decided not to have a My Health Record, to opt out. But as soon as I told them about the patient controls that they can set so they can really be in control of who's accessing their record, then they've decided to go ahead and join My Health Record again. So some of these patient controls include establishing what's called a limited document access code. So that would provide any healthcare providers would need the access code to be able to access those documents that you've added as a limited document access. Patients can also establish a record access code. So any healthcare provider would need to ask the patient what their code is, type in their code to be able to access their My Health Record. There's also a break glass facility, which is only to be used in emergencies, and it's best to document the reason for using it and to indeed determine that it is an emergency. Also, patients can choose to receive an SMS or email alert when providers accessing their record. And as I mentioned, all instances of access to My Health Record are logged and recorded as well. Now, having said all this about patient controls, the whole point of My Health Record is sharing health information. So personally, I feel like I wouldn't be setting it myself. And around Australia, only 0.2, not even 1%, but 0.2% of people that have My Health Record have set the access control. So it's a very small number, but that is an option available, especially if someone has concerns around privacy. So how can Specialise utilize My Health Record? So My Health Record, the way it works is you can access My Health Record through a conformance software. So that's a system that's gone through the conformance process and it's able to connect to My Health Record. Otherwise, you can also access through the National Provider Portal, which is done through your provider digital access account. So if you just type into your browser provider digital access, then you can apply for an account and get connected to the National Provider Portal through there. Also, when it comes to uploading documents, it's done via Conformant software as well. So that's how providers are accessing My Health Record. But what about you and I when we're patients or consumers? So we can actually access it through MyGov, and we can upload documents. So as I mentioned, you can upload any personal health notes, you can upload medications, you can upload allergy updates through your MyGov account. You can also view information in My Health Record through MyGov, but also through authorized apps as well. So as I mentioned, when as a healthcare provider, you'd be able to access My Health Record through the through a Conformant clinical information system. And we do have a register of conformity on our website. So if you want to check to see if your software is conformant with My Health Record, you can always check our website. Otherwise, you can access My Health Record through the National Provider Portal. Now, the National Provider Portal is view only, so you won't be able to upload documents in the National Provider Portal, but it's still very useful to have access to that information. And you can also print out documents, so you can print out those pathology reports or anything that the patient is requesting. And you can also save documents to your local file from the National Provider Portal as well. So when it comes to specialists connecting to My Health Record, the Australian Digital Health Agency is partnered with a lot of specialist software vendors, software providers to integrate the My Health Record system into their clinical information system. So this is something that's come out recently. And so there's a good number of specialist softwares, as you can see, that are in general release. So if you use one of these softwares, you'd be able to access My Health Record. And then we've also got a good number that are in the build and test phase. So they're in the process of getting ready to be able to access My Health Record as well. And this is an example of a specialist letter when it's uploaded into My Health Record. So the specialist will type up their letter as they do with their normal practice, and then they just tick a couple boxes to have it uploaded onto My Health Record. So this is an example of what it looks like. And then certain software will also allow a PDF letterhead with the specialist letter, but the information is the same with both. And it's quite valuable information. And this is actually feedback that we've received from a lot of general practices that they've had difficulty tracking down specialist letters. So this is a great enhancement to the My Health Record system that we can now offer. And that really helps with saving time and money as well for healthcare providers tracking down this information. And it really improves the continuity of care for patients.
Max, can I just interrupt for a minute? Can you just go
Sure.
back to slide with the specialist, the one previous to that? That one. Someone's just asking, was medical director on the list of the conforming software? And
so this is specialist software. So medical director tends to be a practice software, like a general
practice.
Whereas specialists would be using this software, and it's the specialists that need to have access to it to be able to upload the specialist letters. You couldn't be doing it through other software that's not specialist specific.
No, that's right. I just wanted to address that while the question came up. So thanks for that.
No problem. I hope that answers the question.
Yeah, I'm sure it does. Okay. Thank you.
No worries. Okay, so how can My Health Record add value to your practice? So My Health Record can help with medication reconciliation tasks. So through accessing the medicines information view, you can certainly do medication reconciliation quite quickly. Also, just having access to that medication information is so vital for providing the appropriate care to our patients. Also helps with history taking, performing accurate patient assessments, so having all of that information within the shared health summary and the discharge summary, so that you have access to all that information so you can treat a patient appropriately. It also helps with avoiding that duplication of tests, as I mentioned, and also scans, diagnostic imaging tests through access to pathology and diagnostic imaging reports, and helps with the end-of-life care decisions when it comes to referring to the advanced care planning documents and the advanced care wishes for patients. So how to get connected and start using My Health Record. So before you can begin using My Health Record, you need to create what's called a security and access policy. And so this policy needs to be created before registering. And so this policy can be created quite easily by going to the RACP or RACGP websites, and you would be able to get a template from them. So it can be quite easy just following the template. Otherwise, you can also go to our website to be able to access the templates and information about how to create your My Health Record security and access policy. And so when organizations are connecting to My Health Record, first they need to ensure that they have that security and access policy in place. Then they can go ahead and register. They'll need to train their staff so that to see that they're familiar with the policy and how to use My Health Record. And I would recommend signing up for some of the training that we have at the Australian Digital Health Agency. You can attend our training sessions and learn how to use My Health Record and ask any questions in those sessions as well. Then the organization would need to confirm access to staff who've gone through the training and they're appropriate to be able to access My Health Record. And then there's ongoing participation obligations, such as any new staff that come along, they'll need training. Otherwise, we do have a lot of resources on our website that you can refer them to, and you can also sign them up to attend one of our sessions as well. And I'll show you those shortly. So getting connected to My Health Record is as simple as contacting us at the Specialist Connections team. So you can contact us on this number at the Australian Digital Health Agency. So we do have a Specialist Connections team that can support you. Otherwise, you can also contact your local primary healthcare network, and they also have a lot of information that they can provide and support that they can provide with connecting to My Health Record. So as I mentioned, there's a lot of resources on our website. So if you go to digitalhealth.gov.au, that's where the bulk of our resources are. You can also go to the My Health Record website, but the bulk of our resources are here. Also, you can go to the My Health Record helpline, give us a call. If you do have any questions, you can email us at help@digitalhealth.gov.au. And for the latest agency announcements, you can follow us on Facebook, LinkedIn, or Twitter as well. Now, I'll just go to our website just to show you what our resources look like. So just give me a moment. Okay, so when you first open up the website, it's digitalhealth.gov.au. You'll see that there are resources for everyone. So this is for anyone to check through these digital health resources and videos and information around digital health.
I can't, Max, I can't see the, I can just see the PowerPoint presentation with the notes.
Oh, really? Okay.
So I just can't see the live.
Oh, okay. Yeah, let me, is that working now?
That's
No.
No.
No, okay. Let me start again. I'm not sure why that happened. Yeah, usually it works. Okay, let's see if this works. How's that?
That's better.
Yep.
Yes.
Okay.
Lovely. Thank you.
Okay. No problem. So here we can see the website. So we have digitalhealth.gov.au, and on the website, you can see there's a lot of different resources, and these are resources for everyone around digital health. But what I would refer you to is the resources under healthcare providers. So you just need to click this tab up here to get to the healthcare providers. And here you can find information in your area of practice. So if you work with specialists, you can check here. If you work with general practitioners, you can check here. There's nursing and midwifery resources as well. So there's a lot of resources, online training that can be done there. There's fact sheets. So there is information there, and I'll show you some other resources that can be quite helpful. So then there's initiatives and programs that you can refer to. And then these training and support resources are quite helpful. So here you can access a software simulator where you can practice uploading documents to My Health Record and using various software to in a training environment to be accessing My Health Record. Then, and also there's prompts within those software, so you can follow the prompts, and it's quite easy to use. Then you also have online training courses. So here we can see the various courses that you can sign up for, and you get a certificate of completion after this. And let's see if I can go back. Yep. And then we've also got events and webinars here. So here you'll be able to register for any events or webinars that you would be interested in attending. Okay, so I'll just switch back to the PowerPoint and I will hand it over to you, Mark.
Max, for a government website that holds a lot of information, I find that this website really is actually easy to use, and it's great when you show it during these sessions, because I think that also helps people to look at it and go, oh, okay, there's a section there for primary healthcare, or there's a section there for specialists, and then people can actually access what they need. So I would encourage the attendees today to actually get onto that website and access the information they need. It's helpful. Thank you very much for that presentation. From one of the very early slides, I thought it's so interesting, isn't it, that GPs, the use in general practice is 99% use of My Health Record, and the specialist sector 22%. So it's certainly an area that needs to be worked on and is being worked on. And we need to make sure that everyone is connected, and interoperability with these systems is really important. Interestingly, I attended the Digital Health Festival, which was in Melbourne within the last couple of weeks. And the key take-home message is that perhaps the pandemic has made us really kick in and utilise digital health. It's always been around, and things like telehealth has been around for a long time. And so really a pandemic just allowed us to accelerate the adoption of that technology. This is not new technology. We're just accelerating the adoption of utilising it. And that was a comment made by Dr. Nick Coatsworth. He gave the key plenary. And also then Amanda Catamol, who's the CEO of the Australian Digital Health Agency, followed it up with the same message and said the pandemic galvanised us into action. And, they had e-prescribing. It had been having small pilots in different areas across the country, but they had electronic prescribing up and running within 6 weeks. And it just shows that when you need to, that can actually happen. So it was they were some good little highlights of my time attending the Digital Health Festival. And so watch this space, because there's a lot more coming, and people are working together to enable interoperability across different services. And My Health Record does that for the specialist and general practice sectors, so that they can work together for the betterment of patient outcomes. And that's really why we're there for, isn't it? You'll see that a satisfaction poll has appeared on your screen. If you're able to complete that, we would thank you. And I also did put the link to a more formal evaluation form into the chat. And just with 1 minute to go, Max, someone has asked me a question for you. How can I get my GP to upload into My Health Record?
Yeah, absolutely. So they would be able to upload when they are connected to a Conformant software. So I think there was a question earlier about Medical Director, which is a Conformant software. So if, for example, they were using that software, they would be able to upload documents, but they could attend one of our training sessions as well, and we can show them how to upload documents. There is, as I mentioned, resources on our website as well that can help and support them. So they could, GPs would be able to upload the shared health summary. So that is basically a document that has all of the information about the patient in 4 key areas. And usually that's uploaded by the patient's nominated healthcare provider. So that's their regular healthcare provider. They'd also be able to upload event summaries as well. So I would suggest attending one of our training sessions.
And I think the key message, for the GPs as well, is that this will save time in their work. And if somebody shows them where this is located on the software that they're using, that they can access this information. And the example that you gave earlier about someone needing a blood test, I'm sure that we've heard that many times. The patient sees the GP and has a blood test, and perhaps then sees a specialist at some short time after, who then orders a blood test. And, that's just a waste of resource all round, but especially for people's time and health outcomes. So being able to access my health record to save time to see those documents and that information that's uploaded can be really helpful for clinical practice. So I think that's a good take-home message if for that person who says, how can they get their GP to upload to my health record, show and explain the benefit of that. So thanks very much, Max. I see that we're just out of time now. So thank you all for attending today's Nurse Digest session. And once again, thank you to Max. This is the final session in this Nurse Digest series, and we do look forward to you joining us for future discussion about incorporating digital health into everyday practice. So thanks for joining us, and bye for now.
Thanks, everyone.